Medical negligence. Visualized. Medical liability is the physician mistake, like inaccurate and incomplete diagnosis or treatment, which cause the patient injury or death. The affected patient must prove two things, in order to show that he was harmed. First, that the doctor breached his duty of care, by committing an error, whether by ignorance or negligence. Second, that the medical negligence harmed the patient's health, enjoyment of life, and money. Which means that without damage, there is no basis for a claim, regardless of the doctor negligence. On the other hand, the physician has to observe the following duties. First, to follow the standard medical rules and procedures. Second, to document the patient health condition, and his family medical history, before diagnosing and treating him. Third, prescribe to the patient the medicine dosage and side effects, in addition to monitoring the treatment progress and complications. Fourth, to inform the patient of the nature of his illness, unless the patient interest requires the opposite. On the other side, a doctor is restricted from undertaking the following acts: treating the patient without examining him, and without the patient approval in non-emergency cases. Carrying out any act of birth control, or sterilization, unless there is a serious threat to the women's health in case of pregnancy. The fixing of prosthetic on the patient body. Examining a female patient clinically, without the presence of a third person. Adopting artificial insemination, unless from the spouse. Doing unauthorized clinical research on people. In addition, the doctor is prohibited from doing the following acts: cloning human beings. Use an illegal treatment method. Disclose the patient confidential information. Evacuate the patient from the hospital, stop his treatment, or helping to end the patient life. And lastly, the doctor is prohibited from doing anything that would lead to an abortion, except when the early pregnancy is dangerous to the woman's life, or if the fetus is suffering from a serious malformation. But in both cases, the abortion is only allowed before 120 days of pregnancy. After we reviewed what is allowed and what is not, let's see now, what if the doctor is accused of negligence? The law assigned the Supreme Committee of Medical Liability to investigate the causes and relationship between the doctor mistake and the patient harm. However, the doctor may not be arrested during the committee investigation, but he might face criminal and civil charges. Unless the doctor proves that the damage was caused by the patient, or due to an external reason, beyond the doctor control.
Medical malpractice is an act or omission by a medical professional that deviates from the accepted medical standard of care. According to an article from the Journal of the American Medical Association, as many as 225,000 people die each year from medical malpractice, 12,000 deaths from unnecessary surgery, 7,000 deaths from medication errors in hospitals, 20,000 deaths from other errors in hospitals, 80,000 deaths from infections, 106,000 deaths from non-error adverse effects of medication. For every reported medical error that causes injury to a patient, this doesn't include the medical errors that were potentially harmful to the patient. There may be as many as 100 errors that go unreported or undetected. We asked several people what they considered to be medical malpractice. One person responded that, "I would consider medical malpractice to be a medical professional mistreatment of a patient, whether that be prescribing them the wrong medication or physically or emotionally abusing the patient. Also, a medical professional giving the patient the wrong type of therapy when they fully know that it will not help them, or another type of therapy would help the patient more." There have been many cases that have gone to trial over the death of a patient due to the carelessness of medical professionals, or because that of malicious intent by medical professionals. One of these cases is that of Emily Jerry, a girl that was just a year and a half old when she was diagnosed with a large abdominal tumor. Emily had suffered through countless surgeries and painful chemotherapy before finally being declared cancer-free. In order to ensure that she was indeed cancer-free, doctors persuaded Emily's parents to have Emily do one last chemotherapy session. This session consisted of a 3-day treatment that would begin on the day of her second birthday. On the morning of her final day of treatment, a pharmacy technician prepared the intravenous bag, filling it with more than 20 times the recommended dose of sodium chloride. Within hours, Emily was on life support and declared brain dead. 3 days later, she was gone. 20 times the recommended dose. Who could make such a mistake? But sadly, this kind of thing happens to all too frequently in hospitals all around the United States today. Now, had Emily's pharmacy technician done this out of malicious intent? Maybe or maybe not. But because of this trained professional's complete lack of judgment and because no other staff cared enough to double check her bag, this child's life was taken away from her. We asked people what they think should happen to those medical professionals who are aware of mistakes that they make that could be life-threatening to patients or non-life-threatening, and they still don't report any error. One person responded, "I believe that medical professionals should be held accountable for their actions and own up to their mistakes. Failure to report errors they make should result in termination of license or other consequences because these individuals are putting patients at risk." Another responded, "I think that the state should revoke their license. If this mistake goes unspoken of, it shows an intent to harm a patient. Even if it was not the provider's direct intention, it expresses that the provider does not care for the well-being of their patients. Despite being life-threatening or non-life-threatening, I still believe they should have the same consequences because it will send a message to other providers to make smart choices." I want to say it depends on the situation. Both of these interviewees hold a Kantian point of view. Another person we interviewed was on a peer review committee that determined what to do with medical professionals who committed medical malpractice. He responded to this question by saying, "This is a hard question to answer. I want to say it depends on the situation, but that is the wrong answer. All people make errors. The question is, if this error is gross negligence, medical professionals should use judicious prudence when reporting an error. This person holds an Aristotelian point of view."
A lot of these malpractice cases have to do with pure negligence of medical professionals. While a lot of these cases are unintentional, these medical professionals still face huge consequences for their actions. One person we interviewed discussed his encounters with medical professionals committing medical malpractice. He stated, "I was on a peer review committee and the complaint was brought up by the patient and another dentist, but not by the dentist that did the treatment. The consequences for the actions was that the dentist had to refund all fees to the patient. This shows that in a lot of cases, the professional is not punished, but simply has to pay a fine. Whether this is ethical depends on the type of view you hold." Another question we asked our interviewees is, why do you think the errors are made? And what do you think people can do to reduce these errors? One person responded, "Some errors are simply poor outcomes. It will happen with the most skilled practitioners in the history of the world. This is not malpractice. In other cases, it is attempting a procedure in which a healthcare worker does not have the proper training. Let's face it, there can also be greed involved, and that will cloud judgment. If a practitioner has personal problems such as impairment, they also may not be as focused on their patients. It is rare, but I have seen a sociopath make it all the way to private practice. In my opinion, this is the most concerning situation. Fortunately, I have only seen it once, but I have read about it. The neurosurgeon in Texas who was found guilty for manslaughter comes to mind. As far as prevention, it starts with the professional schools. A university sometimes knows that a student does not have the moral aptitude, but they are pushed forward. Obviously, there is also governing that needs to be done by both peers and licensing boards. It is an eye-opener to attend one of those meetings and see the discipline that is levied on practitioners. I think all licensed health professionals should attend one of these meetings. The other issue that is a concern is if we make it too hard for health practitioners to practice. The best and brightest may not enter health professions or leave early. Practicing in fear is unhealthy for both the professional and the patient. Like everything in life, there is balance. Death by medical malpractice is an epidemic that is occurring all too often in the United States that needs to be put to an end. Emily and thousands of other patients have lost their lives due to mistakes made by medical professionals that have been highly trained in their field. Someone must pay for the deaths of these patients.